The following program has been made possible by an educational grant from Bayer Healthcare Pharmaceuticals, Inc.
Welcome. My name is Dr. George Kraft, and I am the Medical Director of the Western MS Center at the University of Washington in Seattle. I am host of this series, this 9-part series of TV programs on multiple sclerosis that is designed to bring the information to your homes so you don't have to go out and listen, so that you and your loved ones can learn more about this disease that impacts many, many people in the United States. This is the next to last program in our series, and it's a very unique and special program. In many ways, I think perhaps the most important program that we'll present to you. It is on complementary and alternative medicine. And I know many of you with MS are very interested in CAM, or complementary and alternative medicine. Many of you may be taking some of the herbs that are part of that repertoire. Tonight we have the world expert on CAM, Dr. Alan Bowling, who comes to us from Denver, Colorado. Dr. Bowling is medical director of the MS service at the Colorado Neurological Institute, and also he is the director of the Complementary and Alternative Medicine program at that institute. And in his capacity in the CAM program, he also deals with herbs and other non-traditional medications for people with other diseases, such as rheumatoid arthritis. I want to give you a few words of background that I think are important before we go into this program. If you were to pick up any newspaper in this country in the late 1890s or early part of the 20th century, you might find many ads for Dr. So-and-so's snake oil. It was guaranteed to cure your cancer. Or Dr. Smith's rub that was guaranteed to cure your baldness. Well, you know, you don't see those anymore because science has taken over. Many of those, if not most of those medications, were probably worthless. Some of them were really dangerous. But they were freely advertised over 100 years ago. In the early part of the 1900s, the United States took it upon itself to scientifically assess medication and their claims. And as you know now, you cannot get a medication, officially get it, unless it's FDA approved by the Federal Drug Administration. And the approval process is quite rigorous. Drugs have to be proven to work in large studies of patients with the disease. They have to meet statistical significant markers, which means they have to have some sort of placebo arm, because the placebo effect in all diseases is quite large. And that means that if you were given a sugar pill for your MS, you might feel much better, but it would be a sugar pill. That's the placebo effect. So all studies have to have some sort of arm in which serves as a placebo or control arm. So science has really taken over, and it's really extremely valuable that it has. And those of you with MS who follow the MS field know that we now have interferons. The first interferon came on the market in October of 1993 in the United States. We have glutarimer acetate. We have natalizumab, a monoclonal antibody that's given by infusion. We have chemotherapeutic agents. And soon we will have some oral agents for multiple sclerosis. All were discovered and proven through the scientific process. So with that in mind, I know that this will come up in our discussion today, but some of the complementary and alternative medicines may actually have value. We don't know. And some of them, actually one of them has currently come on the market, delfampridine. It was 4-aminopyridine, and it was considered a CAM medication until this year. So many of these herbs and other treatments may work. We just don't have them approved. So I'd like to welcome Dr. Alan Bowling.
Great, thanks.
Alan, thanks for coming.
Yeah, pleasure to be here.
What is complementary alternative medicine?
Yeah, that's a very important question before we even talk about the details of it. What is this topic that we're talking about? The term that gets used frequently, you haven't been using it, you've been using the actual correct term, but a term that gets used incorrectly frequently is just alternative medicine. And that's what you often see on TV or lay press or magazines, newspapers. And that term actually is usually used incorrectly. A broader, more appropriate term is actually an unconventional medicine. And what that is medical therapies that are typically not taught in medical school, not generally available in hospitals. That's a little moving target definition because most medical schools now at least give limited instruction about it, but it kind of gives a sense for what we're talking about. It's kind of a weird definition because it says what it is not as opposed to what it is, but I think you get a sense for what the unconventional medicine is, things like acupuncture, diet, supplements. The complementary and alternative come in really in how those unconventional therapies are used. So if you use something that's unconventional like acupuncture alongside conventional medicine, then that's complementary medicine. If you use it instead of conventional medicine, then it's alternative. And then the big umbrella term that you've been describing is complementary and alternative medicine, or CAM. Then there's
so
even
if I just interrupt you here. So what might be CAM in the United States might not be CAM in India.
And that's a very, you're tapping into some aspects of this that I think are quite intriguing, and how we as health professionals and also people with a particular disease in a particular country are sort of, the therapies that are offered really are determined by the social structure within a particular time frame. And then a bigger umbrella term is integrative medicine. That's taking these unconventional therapies along in combination with conventional medicine.
How did you get interested in this really intriguing but unusual topic?
Yes, going back more than 30 years, I've had an interest in kind of gray zones in medicine where science and medicine have suggestive but not definitive evidence for diseases where we don't have cures. So what do you do with that gray zone information as a health professional? So that's intrigued me for a long time. And then starting 15 years ago, I really got immersed in sort of a gray zone within the MS world with unconventional medicine. It struck me that a lot of my patients were seeing me, but when I started asking them, seemed like a lot were pursuing other unconventional therapies. So we actually did a survey through our center and actually found that 2/3 of our patients were using some kind of unconventional medicine in addition to what they were using that we prescribed. So subsequent surveys were done in people with MS in the US, Canada, Europe, Australia. And it's very interesting, all those quite diverse but westernized countries, people with MS, it's about 1/2 to 2/3 in all those countries use some kind of unconventional medicine. And the interesting thing is most of those people in all these surveys, you kind of summate all the information, 90% of the people using unconventional medicine are blending it with conventional medicine, so they're doing the integrative piece. So it struck me that most of my patients were using these unconventional therapies and I didn't have information to provide to them. So one piece of it was purely on the informational side. So I wanted to get information on the table so patients and I could have discussions about this instead of me just telling them to go get some good information and make your own decision. So that was one piece. And then another piece, kind of on a more personal level, was around the same time, 15 years ago, a little more, I can actually remember some very clear interactions with patients with MS whose lives were very affected by MS. And I remember very clearly the clinic visits, and I was kind of doing all the stuff that I usually do and sort of using all the training and education I had. And I remember some of these patients would leave my office and I kind of watched them go down the hallway, and I thought, this is a disease that's really had a huge impact on their life, and yet what happened in the clinic visit didn't feel like it quite tapped into the depth of what was going on, and I knew some of them were pursuing these unconventional therapies. So it got me, there was some humbling experiences there, wondering, is there something else I can be doing, or what are people getting that's not happening here through unconventional therapy? So that really was sort of a turning point in my career, to wonder, is there something beyond conventional medicine that some patients want, and maybe I could sort of play a role in helping that happen for them. And I guess a bigger picture view too is, as you stated at the beginning, early 1900s, there was a big change in a positive direction to make medicine in the U.S. scientific. The Flexner Report is what actually changed a lot of that. But I think I wonder if that made medicine so scientific that maybe the boundaries of it are a little too rigid for some of the patients we see who are willing to consider things that are low risk but might be helpful. Some of the things we talk about, like yoga, that's low risk and might have beneficial effects. So within my career, I wonder if there's maybe for particular patients especially some loosening that can happen on the edges to let in some things that maybe we don't have perfect proof for, but they could give benefit in diseases where conventional medicine doesn't have cures.
So I think what you're saying is that about half of my patients are on some of these drugs, and I don't probably know about it, because this isn't typically something we routinely ask about.
That's right, right.
With the exception of medical marijuana, because in the state of Washington and in Colorado, it's now legal for patients to be not prescribed. We can't prescribe medical marijuana because that would go against our federal drug license for narcotics. But what we do in this state is we can give them a sheet of paper that says, you have my permission to do this, and that will keep them from being arrested if they are caught with this. I presume that's similar in Denver.
Right, in Colorado,
So what do you think about medical marijuana?
Yeah, this is becoming more and more of a timely topic. So it was about 10 years ago, around 2000, when the first states started approving medical marijuana. There now are 13 or 14, and I think there are 10 to 12 states that have initiatives, or it's actually coming up on ballots. So it could be in a few years we have half the states in the United States have some kind of medical marijuana law. It's actually quite a fascinating area in terms of sort of the underlying mechanisms that marijuana works through. It's really quite intriguing in terms of potential applications to MS. So if you look at the chemicals in marijuana and how they act in the nervous system, there are multiple mechanisms. They also act on the immune system. So if you look at the nervous system, some of the chemicals in marijuana act through a very unique mechanism to tone down excess nerve activity. And you can imagine how excess nerve activity could produce something like pain or something like excessive muscle stiffness. So you can imagine how that mechanism could potentially help with MS symptoms. There also are nerves where if they fire too much, they have chemicals called excitatory amino acids. If those fire too much, those excitatory amino acids, instead of communicating a message, they damage nerve cells that are around them. So the chemicals in marijuana have been shown to tone down those nerve cell, just tone down the activity of those nerve cells as well. So that could help with protecting nerve cells from injury. There are also in marijuana, there are chemicals that have antioxidant effects that can decrease free radical damage. So that's another mechanism that could potentially slow down loss of nerve tissue in MS. And then on the immune system side, there are clear mechanisms by which chemicals in marijuana can tone down the activity of immune cells. So with MS, we have immune system activity that's too high. Marijuana could tone that down, and then it could also help prevent damage to the nervous system and maybe help symptoms of MS. So on a theoretical basis, there's good rationale for marijuana, but it's a big step going from what's rational and makes sense theoretically to whether it actually works. So the next step is to actually do animal model studies. In those, multiple studies indicate marijuana's chemicals can tone down the immune system activity, can protect the nervous system, may help with pain and spasticity in animals. So we have the animal model evidence, and then the missing link is ramping it up to human studies. So there have been suggestive human studies of variable quality over the years, suggesting marijuana may help pain, spasticity. High quality study done in the United Kingdom suggesting, but not absolutely proving, that marijuana and some of the chemicals in it may tone down spasticity and may slow down the progression of the disease. But that's not definitive. In MS, the only way to know for sure is testing it in people with the disease.
Question, the United Kingdom study, it was in people though with MS, right?
Yes.
But you say it wasn't definitive, so it wasn't statistically significant as we say, or it wasn't a large enough number or a long enough period of time, or
right. What they was suggesting that it was slowing down disease activity, the progression of disease activity, and it wasn't actually designed specifically to look at that. It was looking more symptomatically.
I see.
And there's been some concern in that study and some other studies that for muscle stiffness, maybe some of the current measures that we use aren't sensitive enough to detect mild changes, which actually may be meaningful to patients, but we can't pick them up in the clinic. So the newer study, which is very large, involves more than 500 people with progressive forms of MS in the United Kingdom, is looking very rigorously, very well-designed study at helping symptoms and also to see if it slows down the progression of disability. For the states that have the medical marijuana laws, I think it's important to keep in mind that even though those laws allow marijuana to be used legally for MS, that doesn't mean that we have evidence that proves that it's safe and effective in MS. We have suggestive evidence, and that's why in most states MS is a permitted use for medical marijuana.
So this large study in the United Kingdom, this well-designed study, has it actually started?
Yeah, it started, and I think they'll have results within, it's a 3-year study, I believe, and I think they'll have results in the spring of 2011. And it's known as, it's kind of a funny name, it's a marijuana study, but the name of it is Cupid. So it's cannabinoid use in progressive inflammatory disease. So, and there are websites that give updates in terms of the progress of the study.
Secondary progressive MS or primary progressive, or
it's
both?
Both, I believe. Secondary and primary progressive.
So my understanding is marijuana, to be effective in the nervous system, really needs to be inhaled as opposed to ingested. Can you comment on that? Is that true or not?
Not necessarily. You know, the study, surprisingly, the earlier United Kingdom study, which was quite well done, they did it with placebo, they did it with THC, one of the active chemicals, one of many active chemicals in marijuana, and then they did an oil extract of marijuana. And I think going into the study, the hypothesis was what you described, that placebo and the THC pill may not have an effect, but there may be some unique effects to the cannabis oil. What they actually found was the THC pill was the one that had more of the effects. But certainly the THC pill, that's just one chemical out of the marijuana. There are many other THC-like chemicals in marijuana. It may be the unique collection that gives people some relief from their symptoms. I do think it's important to keep in mind, we've been talking more sort of the intriguing science and pharmacology to support effectiveness of this. Very important to keep in mind that this isn't totally benign. This isn't like taking a vitamin pill or something like that. So especially smoked marijuana, that's been an issue, that there are carcinogens in marijuana smoke.
Cancer-producing elements.
Right, that are maybe more toxic than what you find in cigarette smoke. So increased risk of various forms of cancer, lung, head, neck cancers, and then the obvious sedating effects, cognitive effects that can happen, perhaps decreasing walking stability in people with MS, impairment of driving ability. So it's not without side effects. And a lot of the newer research in this area, one is to look at safety and effectiveness, but a whole other line of research is other ways to get it into the body the whole herbal mix of chemicals. So it'd be nice if it can be done without smoking. And so there's a whole line of work using extracts, using smokeless ways to inhale the herbal mixture.
Are there different types of marijuana? In other words, different strains that may have different degrees of efficacy?
Yeah, so there's a whole, and that's a complex issue, especially if someone's growing their own or buying it and really not knowing where it's coming from. It's a little like different grapes, different years with wine. You know, you have a very different mix in terms of
or different beans in coffee, we'd say in Seattle.
That's
so,
right. Your latte versus your espresso.
Right.
In terms of making this more regimented, more standardized, there is a spray that can be administered to the mouth called Sativex, and that is derived from marijuana plants that have a set ratio of two of the most important chemicals. So it's THC and then another chemical, cannabidiol, and the ratio of those two has been set in these genetic variants of marijuana. But yeah, that's a challenge when you have multiple chemicals that may be active and sort of using different strains.
Is Sativex available in the United States or North America?
Not in the U.S., but within the North America, available in Canada, approved for use in spasticity. And there's studies suggesting that this can help with pain, can help with spasticity, may help with sleep difficulties as well.
Nausea, cancer, chemotherapy,
right,
I
can
think
be
is used as one of the common places, yes.
I certainly, in terms of my casual observations in a state where medical marijuana is used, there's a whole range of people who use it. Some seem like they were recreational users before they had MS, and they kind of want to keep their recreational use going, and so that's not the majority who I see in my practice. It seems like there's a group of people. It's not a huge percent. I'd say it's less than 5% of my practice where it really seems like they have a symptom that we've tried to address with medications and either side effects or lack of effectiveness, made them then go look for some other approach. And the symptom that I see people using it for most routinely on a day-to-day basis in kind of a genuine way is muscle stiffness that interferes with sleep at night. And it may be they're getting a combined...
Muscle cramps, types of spasms that occur.
Spasticity, right. So that kind of symptom that interferes with sleep, and the marijuana may be helpful for the sleep aspect as well as the muscle stiffness piece.
As fascinating as marijuana is, and I know that...
We could talk for a few hours on that.
Forever. I want to move to another herb that is commonly used, or at least commonly discussed, and that's cognitive impairment. We have a whole program on this, but cognitive impairment is a big problem in MS. Ginkgo biloba is another herb that has been touted to be effective for that. I know there have been some studies, and can you comment on that?
Yeah, this is, once you kind of delve into the herbs, there's some fascinating stories, kind of fascinating histories. So ginkgo actually has the honor of being the most studied herb in terms of clinical trials, but those trials have been in aging-associated memory difficulties, not so much very limited studies.
And it's used widely in Germany, isn't it?
Yeah, Germany and
Europe,
other countries, right. And that's where a lot of the initial trials were done, actually in Germany and surrounding countries. So in terms of ginkgo and sort of its chemical constituents, we're talking about THC and marijuana. So the challenge in these herbs is to find a chemical or a few chemicals that might have effects. So there's a chemical in ginkgo that is very complex. It's so complex that even with all our sophisticated technology, there's no way to mass produce this chemical on a widespread basis. There's no other plant in the world that makes that particular chemical. So the ginkgo leaf is the only place to obtain this. And this chemical has potential anti-inflammatory effects, which could be helpful for MS. It also, within the plant, there are antioxidant compounds, which could help with free radical damage, degenerative processes. So there are reasons why ginkgo could be helpful in MS. As we talked before, the ultimate test for a drug in MS is to test it in the disease. It's such a complex disease, we don't have any a really good animal model. So in terms of clinical studies, there have been studies using ginkgo to try to decrease the severity of attacks. Actually, intravenous ginkgo has been used in large, well-designed studies in Europe, and it doesn't work. So we have good studies showing it doesn't work in that situation. To use ginkgo to try to prevent attacks, like we do with interferons, copaxones, other FDA-approved drugs, that's never been studied. And then there are limited, small studies in people with MS looking at symptoms, and 2 of those suggest it might be helpful for cognition, and another suggests it could be helpful for fatigue. So, you know, with any molecule you take in, there's potential good, and then on the potential bad side, there are these chemicals in ginkgo that can actually increase someone's tendency to bleed. So if someone's taking high-dose aspirin, blood thinners, undergoing surgery, have bleeding disorders, it's not something that should be taken. And also ginkgo might increase seizure risk. So it's definitely a chemical that people should talk to their healthcare provider about to make sure there aren't any potential interactions there.
Of course, with regard to herbs or natural products, I mean, aspirin comes from the bark of a tree, and you know, some of the heart medicines come from other plants. So there's a long history of using natural products for a real, legitimate medical care.
It's been estimated that about 2/3 of medications are derived in some way from natural products.
Are there any other herbs, before we leave herbs, that might be helpful for people in MS?
Yeah, a few to discuss in terms of symptomatic treatment, sort of addressing symptoms you might see with MS. So people with MS can have urinary difficulties, recurrent urinary tract infections. So there's pretty good evidence that cranberry can prevent urinary tract infections, especially in women, young and middle-aged women, and especially women who have essentially normal urinary function, so not real severe urinary abnormalities. So that's potentially effective for prevention. There's no evidence that it's helpful for treatment. So if someone with MS is known to have a urinary tract infection, that can actually worsen the neurological symptoms. So you want to treat that immediately with antibiotics and not use cranberry. But for selected individuals, cranberry could be helpful for urinary tract infection prevention. So that's one. Another is St. John's wort. It's sort of, popularity really peaked in the 1990s when it was sort of a newly rediscovered herb in the United States. Had been used in Europe, especially Germany, for a long time. So there's quite good evidence that it can help with mild to moderate depression. It's not something to be used with severe depression. With anything someone's using for depression, it's important to have healthcare provider input. So depression is really not something someone should be casually diagnosing and treating on their own. This really is something you need to have a conversation with a health provider about. With St. John's wort, there really are relatively few side effects directly from the medication. It sometimes can worsen fatigue. There's photosensitivity, or sort of more higher chance of having sunburn when exposed to the sun. So photosensitivity
it's not a problem
is
in
the term
Seattle.
there.
So
That's right. Okay, right. So those are the side effects. But the side effects of St. John's wort generally are not a big issue. A bigger issue is all the potential drug interactions. So over the years, starting several years ago, there were interactions noted between St. John's wort and multiple medications, and that work has kind of expanded over the years, so it's actually quite a long list. Some of the early work was actually with birth control pills. So the joke early on was there may be lots of little St. John's running around. So because the birth control pill not working because people were taking St. John's wort. So anticonvulsants, antidepressant medications. So if someone's thinking about St. John's wort, they really need to talk to a health provider to make sure there aren't interactions going on.
this might be a good time to tell our viewers about your website, because Dr.
Great.
Bowling does have a website that I think is pretty chronically updated with new information. It's pretty expansive, and in an hour show we can't really talk about all these things. So you might want to comment where they can find this.
Yeah, so the website, and there are no gimmicks here, there are no fees, there's no tracking who goes, you don't register, so it's completely free information, and it's updated on a regular basis. So the website is www.neurologycare.net. And then if you go to the site, there's a place you can click for complementary and alternative medicine information. And then within that information page, you can then access information on all the topics and many more. There are hundreds of pages of information about complementary and alternative medicine. Also, if you go to that site, there's you can see various books that I've written as well on this topic, and those click the links where you can purchase the books. And I'll mention that the royalties from all of those books go to various MS not-for-profits in the U.S. and around the world.
And I'm going to comment that on the first program I showed you our book on MS care, and all those royalties go to our research center too. So this is good. I'm going to move over to vitamins, because we could talk forever about herbs as well. How much vitamin D do you recommend? That's very popular right now. And comments on that?
Yeah, that's. I think that's an important topic for, in my opinion, everyone who has MS should have a discussion with their health provider. There's no absolute dogmatic answer to the particular question that you asked. In terms of, I'll give a little background information here. So over the last, actually going back 10 to 20 years, there have been suggestive studies, so intermittent studies, but not really pursued fully. And then especially the last few years, multiple studies suggesting that low vitamin D puts some people at risk to develop MS. And then for people who have MS, low vitamin D puts them at risk for having attacks and maybe more rapid progression of disability. Now, these are suggestive studies. They're sort of associations of low vitamin D with these potential worsening of the disease process. The definitive studies where you give vitamin D to see if it actually helps people with MS, those are in the works. So we don't have that. So these are suggestive studies, but they're quite suggestive studies that are out there. And it's all based on two big changes in our understanding of vitamin D. So we've been incorrect for quite a long time about vitamin D. So two things that we've been incorrect about are, one is we fortify our foods in the United States with vitamin D, therefore we all must be getting adequate vitamin D. That's not true. So many studies show that at least 50% of American adults are deficient or insufficient in their levels of vitamin D. So that's one thing that has not been correct about assumptions. The other is that vitamin D...
Excuse me, but do you see the government changing that?
There's been a lot of discussion, but nothing has, there haven't been dramatic changes at this point. You know, maybe the long-term approach would be to fortify more foods at a higher level, but that's not being done at this point. In terms of something on a very broad, widespread basis that sort of permeates out to all Americans, the biggest step I've seen is with the American Academy of Pediatrics, where for children from birth to age 18, a couple of years ago, the recommended daily amount went from 200 units to 400 units. So that's been a change on the pediatric side. But
is that sufficient? Is 400 even sufficient?
May not be, but it's stepping in the right direction. The other interesting aspect of vitamin D that really the research here started in a solid way 10 years ago, you know, the thinking about vitamin D has been that it really just relates to bone health. And that's definitely not true. So the proteins in the body that make active vitamin D, the proteins that respond to vitamin D, those are present throughout our body, including on nerve cells, muscle cells, immune cells. Vitamin D has important roles in regulating immune function. So when you start hearing this, you know, when you first hear vitamin D related to MS, how is, that's a bone vitamin, what could the connection be? But now we know these are connections of vitamin D to the nervous system and the immune system. So that's sort of the background scenario. And then the question is what to do. One thing is to do nothing. In the United States, I think that still may be the most common approach, and I'm not sure if that's deliberate or people just don't have the information, and that's some of that may be just on the health professional side, because it takes time to kind of get informed on this. So one is to do nothing. Another is just to blindly take extra vitamin D. That's hard to know what to take. It might depend on what part of the country you're in, whether you have cloudy days or sunny days, but could take some extra vitamin D. It's not really clear what that should be. And then the most precise way is to have a blood level done with vitamin D. If it's low, then you supplement with extra vitamin D, and then you recheck the vitamin D in 3 to 6 months. And then if the levels come up, then you've corrected the issue. If it doesn't come up, then you take more supplement to get it into the normal range.
What is your target range?
So the normal levels that are typically published on lab reports, the lower limit often is listed as 20 to 30, and the units should be unfamiliar to most of the audience, but it's nanograms per ml. That's what's listed on most lab reports. So 20 to 30 is what's typically listed on the low end, up to 100. But many organizations think the lower end should be 35 to 40. So a range of 40 to 50, and it's important to keep in mind that unlike a lot of other blood tests, nearly all blood tests are kind of same throughout the year. With vitamin D, it fluctuates, so it's going to actually be at its lowest point in the winter months.
I have several patients that have sort of self-prescribed and taking vitamin D, and they've got taking huge numbers. Like, are there any dangers in getting your blood levels over 100?
Right. So
do we know? I don't know that we know.
Yeah, we don't have great information. You know, there are some safety studies in people with MS taking very high amounts. For example, 40,000 units a day. And I'll look in the camera and say, don't do that. That's in the formal clinical trial, so that's not something people should be doing on their own. In that short-term study, they didn't find any side effects, but we're talking about people doing this for years and years. And we're talking about the whole body. We're not talking about just the nervous system. So there are some protocols for taking very high doses. There are some websites that say people with MS should all be taking 5,000 units a day. You know, doesn't even say what, independent of what the level is. And in my opinion, you really need to work, if you're going to address this in an appropriate way, you really need to work with the blood levels. And in my opinion, you know, this is a molecule just like a drug, and when we give big doses of molecules that the body's not used to seeing, there are always potential good effects and bad effects. We don't at this time know any harm to correcting a low vitamin D, but that's, I think we need to not use, my approach with the bodies is not to use sort of drugs in a sort of sledgehammer approach, but sort of gently introduce them and gently take them away.
Before we leave vitamin D, move on to diets. I want to ask you, I know there are two types, at least commonly D2 and D3.
Right.
I'm going to comment on the two types.
Yeah, so the type that typically was available in the past was vitamin D2. The type that probably makes more sense to use, it's the same price as D2, is vitamin D3. Reasons for thinking about doing that: one is it lasts longer, so it stays in its active form in a longer time when it's just kind of sitting on the shelf. The other aspect to this is I was talking about tissues other than the bone that respond to vitamin D, like muscle cells and nerve cells and immune cells. Some of those cells seem more responsive to vitamin D3 than vitamin D2. Also, in terms of sort of the underlying biochemistry, how these drugs these are broken down, it may be easier to raise the levels with D3 as opposed to D2.
So I think vitamins are as easy a segue as I can think to move into the question on diets.
That's right. Yeah.
You know, in the Northwest, diets have been something that have been talked about for a long, long time.
Yeah.
I'm going to comment on the latest science on diets if you have MS.
Certainly, yeah. Rich history up here. Dr. Swank in Oregon developing the swank diet, and really was a lot of his work back in the 1940s that led to developing dietary approaches based on saturated and polyunsaturated fats. So if you kind of look at those diet strategies developed through his work and some others' work, the basic approach has been to cut back saturated fat, like the fat you find in red meat, increase polyunsaturated fat, which includes omega-6 and omega-3 fatty acids. The ones where there's probably more rationale are the omega-3 fatty acids. And if you kind of look at all the different studies that are out there, and when you start looking at this stuff, it's amazing what a long history there is, especially on the basic science side. So there certainly are scientific studies indicating that saturated fats may mildly activate the immune system, while omega-3s may mildly inhibit, and then omega-6s mildly inhibit, and omega-3s may inhibit it somewhat further. So the rationale scientifically would be to cut back on the saturated fats and to increase the polyunsaturated, especially the omega-3. So that's kind of the scientific piece, and there are more than 100 studies to support that, the arguments that I just gave there. As we keep talking, it's a big step from the lab to actually an effective treatment for people with the disease. Animal model studies suggest this dietary approach may be helpful, and then the ultimate test are clinical trials. So the older trials that Dr. Swank did, unfortunately, they didn't have a placebo-treated group. Many people dropped out of the study. I think he was doing the best he could with the tools of the time, but you can't interpret those study results.
And we've talked about the importance of having that placebo arm, because 30 or so % of people are going to positively respond with that.
Right. And if people drop out of the study, they may not be responding to it, and so you don't factor them in.
That's right.
So to try to be more rigorous, there actually were quite well done studies in the late 1970s, early 80s. So this is kind of ancient medical history, the way medicine is advancing now. But well-designed studies, controlled studies with placebo groups. And in those studies, there was an indication that omega-6 fatty acids had some beneficial effects, mildly beneficial, but a trend for benefit. And then with omega-3s, which probably make the most sense scientifically, there was a study done in the United Kingdom where appeared to be a therapeutic effect, a trend for it. And for people who know statistics, the p-value was 0.07. We looked for 0.05. So it was trending pretty strongly, but not quite statistically significant. So there's been a smaller study using fish oil in combination with interferons or copaxone, some suggestive beneficial effects there. The missing link in all of this, we go from the test tube to the animal model, and then the missing link here has always been a very well-designed study of, for example, fish oil in combination with one of the injectable MS medications, and using MRI measures, looking at attack rate, look at progression of disability. That's always been the missing link, and they have actually just finished the study that I am talking about. This missing link study has actually just been completed in Norway, so we're all anxiously awaiting the results. So hopefully we'll get some firm details about the results of that study in the next year or so as it comes out for publication.
That's very...
Well, in terms of what do we do with all this information when I'm talking to my patient? How do you translate all this positive, negative, possible data? So what I tell my patients is, as a neurologist, I think the jury's still out. We need the results of this definitive study. But I tell my patients, if I had MS and I wanted to use some dietary approaches that were low risk and had the best evidence for effectiveness, the two I would think about would be vitamin D and the polyunsaturated fatty acid approach, which basically is to cut back saturated fat and really try to increase omega-3, some with fish, and then to consider fish oil supplements. If people do that, they really need to talk to their primary care or their neurologist about doing that.
Again, we could talk forever on that.
That's right.
Yeah, so.
And I will tell people on the references I gave, the website, there are many, many pages about the data and then practical things.
And we should give the website again, so I'm sure that will be posted again.
That's right. So yeah, it's neurologycare.net.
Yes, good. Changing direction a little bit here. There is a treatment that I think was very popular in the late 1980s, 1990s, which I think is dropping off, at least in this part of the country, but maybe in other parts, and that is bee venom therapy.
Right.
There are patients that swear by it, and there are patients who swear at it.
That's right.
So I'd like to hear your comments on that. Any studies on it? I think there have been. I'm not sure what they show.
Yeah. So that's this in an area. There are some areas of unconventional medicine where we just have no information related to MS. So it's just a total black box, and you really can't even. There's not even quite clear what the scientific rationale is. So those, it's hard to say too much because we just don't have much information. The bee venom therapy, BVT is the term that's sometimes used there. So what that is it basically involves taking bees, applying them to the skin, and inducing bee stings. Sometimes
doesn't
in
sound
particular
pleasant to me.
locations. That's right. And there are particular protocols that are suggested. One that is sometimes suggested for people with MS who've had optic neuritis, where they lose vision around the eye, is to actually do the bee stings around the eye. So those are the protocols that are out there, and then the question is, what's the evidence? Do we have any? And like I say, this is one where we actually do have quite a well-designed study. So there's a group in the Netherlands back 6 to 7 years ago who conducted a study, reported it in the medical literature, a very well-designed study looking at people treated with a control group and a bee venom group. And they looked at all the stuff we look at in conventional medication trials. They had the control group, and then they looked at various MS symptoms, looked at attack rate, looked at MRI measures. Well done study, all the data is there, and there wasn't any benefit for any of those parameters. So I think that's an approach. And then in terms of safety, it's very rare, but there can be very severe allergic reactions, anaphylaxis that can happen with major breathing problems. So generally, bee stings are tolerated quite well, but there's a very, very rare risk of anaphylaxis. And in terms of that specific suggestion of putting bees around the eye for optic neuritis, there actually are reports in the literature of people who don't have MS with bee stings around the eye that causes optic neuritis. So that's definitely something to not do when you're in the midst of an episode of optic neuritis. But overall, it's generally a well-tolerated therapy, but we have quite good evidence. Other than the pain that you have every time you do it, right? So, but no severe side effects usually. But there's quite a good study showing it does not have beneficial effects for MS.
Thank you. About 30 or 35 years ago, in the New England Journal of Medicine, which is maybe the most prestigious medical journal, or one of them that we have here, there was a study indicating hyperbaric oxygen, or oxygen under high pressure, was helpful to MS. Can you comment on that?
Yeah, that's a study that still gets quoted quite frequently. And yeah, as you say, in maybe the most respected medical journal that's out there. So what was noted in that study was that people with MS had improvement in multiple symptoms when they were treated with this hyperbaric oxygen. So yeah, that was back around 1980, 1983. And there are various places in the United States and other countries where, based on that study, hyperbaric oxygen is heavily promoted, sometimes sort of aggressively marketed to people with MS. What sometimes isn't mentioned is that after that 1983 study, there were multiple studies that were as good or better in terms of their design. So 8 to 10 studies after that were excellent studies that did not show a beneficial effect. And then so those are 8 to 10 high quality studies, and then over the years independent groups that have no connection to any of the research world in hyperbaric oxygen. They've just objectively looked at all the studies in this area, and these objective reviews conclude that there's no evidence for a consistent, clinically meaningful benefit with hyperbaric oxygen, and the conclusion from these studies is that this really isn't something that should be used. There's not evidence to support its use on a widespread basis in people with MS. So I think that's one that is important because there are some freestanding centers that do hyperbaric oxygen. I think people really need to look at the evidence that's provided for the particular conditions that that's recommended for.
Moving to another area, a really very large area, which I think we want to certainly cover, is medical practices from other cultures, such as traditional Chinese or Indian medicine, and the concepts of the meridians, which are widespread in fairly popular in the West Coast of the United States. Can you comment on all that?
Yeah, so that whole area, I find it quite intriguing. A lot of this kind of goes back to the initial question, what is conventional medicine and what is unconventional medicine, and how it really is tied into the culture that we're in, and the health professionals within a given culture are trained within a particular system. So you start looking outside your system and looking at other time periods in other parts of the world, it can really kind of open up your eyes to realize that sometimes we all kind of have blinders on when we're within a particular culture. And having those blinders on as health professionals may not be the best approach for optimizing the options for all our patients with very diverse interests and needs. So that's a long lead into talking about these particular approaches. So Ayurveda was developed in India thousands of years ago, traditional Chinese medicine.
What is
in
Ayurveda?
China.
What is
so Ayurveda is a multimodal treatment approach that includes supplements, some herbal products, but also within that is yoga, there can be meditation as well, thoughtful approach to lifestyle. So it's really kind of covering lots of different bases with Ayurveda. And the element that most people are familiar with is the yoga, but there is this supplement approach with herbs and other supplements. And sort of similar, sort of multimodal, diverse approach is traditional Chinese medicine. Sometimes people think that just means acupuncture, but within that there also is supplement or herbal approaches. So Chinese herbs are used quite frequently in this country and in other cultures. Tai Chi is a component of traditional Chinese medicine. There also are suggestions in terms of diet approaches, lifestyle type approaches, stress management with meditation is a piece of that. So these are broad-based healing methods, and if you look at them, I think it's intriguing. Like I was saying, we often get kind of stuck in the framework that we're trained in, that we have adopted within our country, and I think it's quite impressive that thousands of years ago these ancient cultures came up with very broad-based approaches to healing, which I think maybe we can learn some from. From a Western perspective, we often get focused on, with MS, like what drug is being taken, what does the MRI show, what are the blood tests, what's the neurologic exam. It's sort of quite a narrow view, and we often don't sort of build in a big picture approach to the whole person, and how can all the different aspects of that person be used to optimize how they're dealing with their MS. And some of these more ancient traditions may have done a better job there. So I think it's quite admirable, the broad-based approach of these. Within those systems, you know, Tai Chi with Ayurveda, yoga with traditional Chinese medicine, you know, those have some those are quite different than exercise we do with a Western-based approach. Western-based is typically cardio-type exercise, strengthening-type exercise. Something that's often missing from a Western approach to exercise for people with MS are balance exercises. And often that's the most predominant deficit, especially people with early and mild MS. So a nice thing about Tai Chi and yoga, a critical element of that is balance, and there also can be cardio and a strengthening aspect to it. So you have sort of Tai Chi and yoga as elements of those traditions that have potential applications. Acupuncture with traditional Chinese medicine.
What are meridians? Because acupuncture is defined to be done along certain meridians.
Right.
What
So
are they exactly?
the thought there with traditional Chinese medicine, some of these other ancient healing methods, also with reflexology, is that there are there's energy within the body and it flows in particular pathways. So the meridians are the pathways through which the energy flows. The thought is if you put an acupuncture needle in a meridian, you can direct the flow in a way that's going to improve the health of the overall person.
We've really covered a lot here in this hour, and I know there's much more to cover, and going to your website will let the viewers really check out things they're really interested in. But I want to kind of ask you as a sort of concluding question, Are there any specific herbs that could be dangerous for people with MS or dangerous with interferons or glutathione acetate or chemotherapy?
Yeah, so that sort of leads from what we were just talking about with these ancient healing methods.
Any
so I think a broad
major
category,
things to be?
Yeah, so the concern with MS, it's immune system activity that's excessive. Our drugs are designed to decrease the immune system activity. So there's some very confusing lay information out there that says MS is an immune disease, therefore you need to take supplements to activate your immune system. We really want to do the opposite. So herbs and supplements that activate the immune system should be avoided in people with MS. That includes echinacea, which for unclear reasons sometimes is recommended for MS. That should not be done.
Okay.
High doses of antioxidants, ashwagandha, that Ayurvedic herb, and then some of the traditional Chinese herbal products. And then the website has very long lists of supplements that people should avoid.
And can you give us that website again?
Okay, so it's neurologycare.net.
Dr. Bowling, I want to thank you really very much for
Okay.
coming to Seattle and really bringing a lot of information to our viewers. And I hope you all enjoyed and will profit from some of the information that Dr. Bowling shared with us. Thank you very much.
Great, good. Thanks a lot.
Okay.